All right, Year 12s, this is it, our last lesson for Health and Human Development, and just finishing off the content from Area of Study 2 of Unit 4. So all of this is basically what will be in the final SAC in week 1 back at school. So we've looked at the Sustainable Development Goals in quite a bit of detail, particularly SDG 3, and then SDGs 1 to 6 and 13, and their relationship with SDG 3. And the last thing we need to look at now is the World Health Organization, and in particular, the priorities and the work of this organization. This is just a bit of background information. So you don't necessarily need to kind of write this down, but it just kind of helps you to understand, because we've talked about the World Health Organization before, but not in a lot of detail. So the World Health Organization is a branch of the United Nations. Okay, so they technically come under the United Nations, and they focus on quite a few different things. One of their big focuses is on fighting infectious diseases, and obviously this year that is extremely relevant. They've been in the news a lot with coronavirus and the global response to that. Tackling non-communicable diseases, and this is a kind of a newer priority. Promoting maternal and child health. They've been working on that for a very long time. Ensuring access to clean water, food, environmental protection, and social rights. Okay, so remember we're looking here at things like those broader determinants of health, which we have kind of touched on before, the things that aren't necessarily directly related to health, but very closely linked. Ensuring access to medicines and vaccines, and leading and coordinating health responses. This is just quite interesting to have a look at a real snapshot of what their vision and their mission is. Again, you don't need to memorize these, but especially if you're interested in maybe international work in the future or work in healthcare, it's always good to know what the goals of an organization are. So whose vision is a world in which all people attain the highest possible standard of health and well-being. And their mission, the way they want that to be achieved, is to promote health, keep the world safe, and serve the vulnerable. And we've looked at this, I guess, quite a lot in Unit 4, at those differences between high and low income countries. What I want you to do for question 1 is I've posted a link to a short video. The video, you may have heard, if you watch the news a lot, you might have heard a few months ago that Donald Trump basically withdrew funding of the World Health Organization. The World Health Organization has never been in the news as much as it is this year, but he basically said that they have failed in their job to protect the world against coronavirus, which I think is a bit rich coming from him. But the video then kind of just has a good little overview of the history of the World Health Organization and what it is that they do. So I want you just to kind of give a little explanation of the World Health Organization, but also think of what some of the challenges might be that are facing this organization. And I guess with that, keep in mind that the World Health Organization doesn't directly control how countries run their healthcare system. Okay, so they kind of give a lot of advice and things like that, which we'll look at more, but they don't technically have any direct control. So just go in and write a kind of short paragraph on that. All right, so the study design says you need to know the priorities and the work of the World Health Organization. So we'll start with the priorities. These years I've included because last year in 2019 there was basically a new kind of assembly of the World Health Organization where they came up with their new framework. Okay, so up until 2023, the 3 specific priorities of the World Health Organization are achieving universal health coverage, addressing health emergencies, and promoting healthier populations. These you do need to know. Okay, it's in the study design. You need to know these 3 priorities. We're going to look at the 3 of them in a bit more detail now over the next few slides. As we go through these next 3 slides, I want you just to pause at the end of each one and just complete the information in the table in the document. So the first priority is achieving universal health coverage, and their specific target for that is 1 billion more people benefiting from universal health coverage. Some of the ways that the World Health Organization aims to achieve this are by addressing issues around access and quality of services. So that could be whether or not there's enough money available for health services, where people are located. So in this picture you can see here like a mobile health van that goes around to places in people in remote areas. And also things like cultural barriers, so making sure that healthcare is made and tailored for the local communities. They also address health workforces, so through things like training, maybe helping countries to come up with funding so they can employ people in health work, providing access to medicines, vaccines, and other health products. You may remember we watched a short documentary on the cold chain mission, which showed just how difficult it can be keeping vaccines cold and getting them to the most remote corners of the world to ensure that everyone has access to these medicines and vaccines. Governance and finance. So this is basically helping countries, especially countries that have, quite poor systems, poor government systems in place. Health information systems. This usually relates to things like data management, being able to track diseases and things like that. Advocacy as well, so basically just providing kind of education and support to countries. And that kind of feeds into that as well, providing specific support to countries that need it the most. And often this is kind of our low and middle income countries because of things like not having good governance, not having health information systems, not having access to things that they need to run a good healthcare system. Okay, so in the table, I want you to put in the target and then also just choose 2 of these, 2 from this list, and discuss how they could help to achieve universal health coverage. The next priority is addressing health emergencies. Again, this year is a pretty huge example of this. The target for this is 1 billion more people better protected from health emergencies. This is kind of being addressed through a few different ways. One is the early identification of epidemics and health emergencies. COVID being a great example of that. The first case was diagnosed in China in kind of late December, and by I think the 5th of January, the World Health Organization had declared that an emergency. They already knew that this was going to be big and it was going to travel around the world. Building the capacity of regions and countries to address health emergencies. So things like, can countries set up quarantine procedures? Can they contact trace? So do they have the infrastructure to contact people that are sick? Can they keep people isolated? Can they diagnose and treat the illnesses? All of these kind of things come into it. Ensuring the rapid access to essential life-saving health services. So an example of this would be the Ebola outbreak in Africa a few years ago. This was a really, really deadly disease, and it required a lot of equipment and trained personnel that just weren't available in those countries. So the World Health Organization would be responsible for getting, doctors from other countries, getting all of these suits, getting all the supplies and sending them to countries where they're needed. and also ensuring access to disease prevention measures. Obviously, the best way to address a health emergency is to stop it happening in the first place. So these are things like vaccines, sanitation. We know that a lot of diseases spread through unclean water. Could be things like mosquito nets, all those kind of things that can stop diseases spreading in the first place. Okay, so just jump into back into the table, pop in the target and choose 2 of these strategies and kind of discuss how that could help address health emergencies. Right, the last priority is promoting healthier populations. Target for this is 1 billion more people enjoying better health and well-being. This is addressed through a few different areas and a few different priorities. And remembering these were written in 2019 based on what are the biggest issues around the world at the moment. So the first one is accelerating action on preventing non-communicable diseases and promoting mental health. Hopefully you kind of notice that they are key features of SDG 3, which we've talked about a lot. Both of these are big focuses of SDG 3. Eliminating and eradicating communicable diseases such as HIV, TB, malaria, again, key features of SDG 3. Tackling antimicrobial resistance. So this is looking at how some diseases are kind of developing resistance to the drugs and the treatments that we use. And also addressing the health effects of climate change, particularly in small island countries and other vulnerable states. Island countries tend to be a big focus because obviously islands are at sea level already, and if sea levels are rising, they're at a much bigger risk of flooding. If you have a lot of water in an area that is flooding, you've got a big risk of diseases like cholera, or it attracts mosquitoes that carry things like malaria, dengue fever, all of those kinds of things. So just finish off that table, put in the target, and discuss 2 of these particular strategies and how they could help to promote healthier populations. This is a good little recap of those priorities. So the 6 examples here, I want you to relate to the best WHO priority or the most relevant WHO priority between universal health coverage, health emergencies, and promoting healthier populations. All right, the final bit now is looking at the work of the World Health Organization. So the priorities are what they want to focus on, what they want to achieve. This is how they do it. Now, remember from the video and from the beginning, the World Health Organization doesn't technically run any healthcare systems. It doesn't employ any doctors. It doesn't have hospitals. So what do they do? How do they achieve global health? So we'll go through these one by one. In the document, you'll need to write what the kind of area of work is and then give some examples. So the first area of work is providing leadership and creating partnerships that promote health and well-being. So some examples of this would be partnerships between countries or private organizations to develop vaccines, partnerships to prevent the spread of disease. So this year being a really big one on that. Countries have had to work together to try and manage coronavirus. And also partnerships to provide health relief during disasters. So that's things like, sending doctors to countries if there's been a health emergency or a natural disaster. So they don't technically employ those doctors, but they collaborate with organizations. The next area of work is conducting research and providing health and well-being information. So the types of things we're looking at here is researching new diseases and giving guidelines on that. So COVID being a great example. When it first appeared, no one knew what it was. So they had to figure out that it was a virus, how it was spreading, how contagious it was, what the long-term impacts of that would be. Researching new medicines and treatments, obviously. Things are constantly being created or improved. and creating health management systems. So that's often looking at things like e-health and technology that tracks health. The third area of work is setting norms and standards and promote their implementation. What that means is that, globally people use the same kind of information or the same wording or the same data collection and things like that. So some examples of that would be international disease classifications. So, diseases are classified based on what causes them, how they spread. There's a World Health Organization essential medicines list. So this is making, that there's a document that says if you have this disease, this is the medicine that is used to treat it. They're also involved in things like creating global standards for air and water quality. Now, that's not something we'd be too familiar with, but when I used to live in Vietnam, for example, the air quality was terrible, lots and lots of pollution. So, you could open an app and it would tell you what the air quality was that day, and it would tell you whether it's in a safe or an unsafe range. Okay, so the World Health Organization is involved in those kinds of things. They're also involved in developing policies to assist countries to take action to promote health and well-being. So remember, some countries don't have good health systems in place. So the World Health Organization kind of helps with things like creating frameworks on tobacco control, healthy eating and physical activity guidelines, all of those kind of things that we're quite familiar with in Australia. They also provide technical support and help to build sustainable health systems. So again, a lot of countries have very, very poor or weak health systems. So often they need help with things like developing a health finance strategy. Health systems cost money, and some countries don't know how to get that money. So things like, having a section of tax that goes towards health systems. And part of that is advocating to countries the importance of free healthcare. So in order to provide free healthcare to citizens, they need to have things like this in place. And the last main area of work is monitoring health and well-being trends. So this is things like collecting data from all different countries on different diseases, mortality rates, life expectancy, all of those kind of health indicators that we know very well by now, having that information available and published, so that information is available online for any country that has appropriate data. Okay, so just go in and fill in that table if you haven't been doing it as you go. All right, that is it. Unfortunately, they cut a bit of the content from Unit 4 for this year. So usually we kind of, finish with looking at some really beautiful examples of foreign aid and how people can help, countries that are low income and how you as an individual can make a bit of a difference. So unfortunately that's been taken out, but, really, really, really encourage you, if you get any chance in your life, travel around the world, see what life is like in other places, go live overseas, all of these kind of things, really open your eyes to how lucky we really are here. And also, the progress that is being made around the world. Okay, so just remember all of this is accessible in the final SAC back at school. Till then, have a lovely break, and I'm really, really looking forward to seeing you all back at school in a few weeks. Bye.